the Jake Giffin Podcast.
All right, you know the phrase, you get what you pay for. In health insurance, it often translates to you pay more, someone else makes more. And you don't even know who. Enter Donovan Pyle, insurer, broker, insider turned whistleblower. He says he's discovered how the system cheats employers and robs patients from within, and he's trying to rewire the entire business of health benefits. Today, we're going to ask him which carriers are running the con, what does the brokerage blind spot really look like on paper, and because I'm a glutton for tension, how do you fight for transparency in an industry built on opacity? Donovan Pyle, welcome to the Jake Giffin Podcast, sir.
Jake, it's so good to be here, and this is such an important topic, and I'm so glad that it's really become, top of mind in the media, even though they don't focus on the disease itself. They always just talk about the symptoms, but we're here to change all that and really bring some new insights and change the conversation so that we can actually solve some meaningful problems. Thanks for having me.
That's a fact, man. Thanks for being here. What was the moment? I mean, you were on the inside. You're doing, and we'll get a little bit to that in a little bit, but what was the moment when you realized that you just can't do it anymore?
Yeah, so I was working for a legacy brokerage firm. I thought my job was really to protect employers from insurance companies and look out for their best interests. And I actually got fired for doing that. I got fired for being too hard on a health insurer who happened to pay the brokerage firm their largest bonus each year. And that's really when the light bulb went off for me.
Interesting. So what does that look like in layman's terms? From, if you're gonna timeline that out, what did you blow up there?
Yeah, so basically I was promoting some different ways of financing and procuring healthcare for our customers, which were mid-sized small businesses, and oftentimes that's involved moving them away from a legacy carrier towards something else.
Can we name names, or is it? Are we setting ourselves up?
Well, there's only a handful of legacy carriers out there, so you can surmise from there.
Okay, so they have a way that they want you, as a broker, they have a way, something they want you to sell, something that they want you to promote, and you decided, no, I don't want to do that.
Yeah, exactly. And the whole reason that I wrote my book, which is coming out on November 12th, is to help executives understand this landscape, the supply chain. And because let's face it, this is a confusing landscape. And if you don't understand the basics, it's impossible to make effective business decisions. So let's just level set for 1 second here.
Yeah.
Just for the audience. Because everyone in the media talks about the individual marketplace. That's 5% of the American population. The big opportunity is within the employer channel. U.S. employers cover 164 million Americans with healthcare benefits each year. They spent $1.3 trillion doing it last year. But here's the thing. 25% of what they spent last year was complete waste. That's $325 billion, or about $4,000 per employee per year. It's not sustainable and it's not necessary. There are ways around this if we only understand who does what and why.
Yeah, that's a crazy amount of waste. And we're providing health insurance on some level because we have to. And I don't want to digress from our flow, but there was something that changed when Obama was when they pushed the Affordable Care Act. Does that have any relevance on how things changed?
100%. And again, I think it's really a failure of the media to educate the population about what the Affordable Care Act actually meant. Now, I will say, yes, there were good things that the Affordable Care Act did, but it doesn't just affect the individual marketplace, which again, consists of 5% of the population. It had huge, widespread implications for the employer market, which covers about 50% of the country. And so let's dive into, there are two structural things that the ACA did that are hugely inflationary. And so I don't think, and just listen, I wrote my book because despite all this uphill battle from a regulatory perspective, there are still so many easy things that employers can do in the private sector without an act of Congress to actually reclaim this waste. But let's just, while we're talking about the legislative landscape, let's dive into a couple of structural things. These are not sexy, okay? You will never hear about this in the media because it's not sexy. Your audience is probably much more sophisticated than the media gives them credit for. So I'm going to dive into it very quickly.
Yep.
The first one is what's known as the medical loss ratio rules. Here's what that meant. Basically, the pitch to America was, listen, these insurance companies are making too much money. Here's what we're going to do. We're going to artificially cap their profit margins by instituting what's called the medical loss ratio rules. Here's what it means. 85 cents on every premium dollar must be spent on healthcare itself, right? The hospitalizations, the surgeries, the labs, the imaging, the drugs, right? 85 cents of every premium dollar needs to be spent on the care itself. And if you don't spend 85 cents on the care itself, you have to refund the difference back to the employer and the employees. Okay, that sounds like a great, on the surface, that sounds like a great consumer protection. We're protecting, patients from these insurance companies, yada, yada. Sounds wonderful. But the insurance companies are very smart. They said, oh, you're gonna cap our margins? Here's what we're going to do. We're going to buy up the healthcare supply chain itself. We're going to start making more money on selling the services and the goods themselves. And here's what I mean by that. All the major insurers bought pharmacy benefit managers. And if you listen to their quarterly earnings reports, they make more money off of selling drugs to employee populations than off the insurance itself. Insurance is almost a loss leader for selling drugs. That's where we're at.
So they went vertical integration. They said we're going to provide the insurance, then we're going to provide all the ancillary services associated with it.
Yes.
So if I'm understanding this right, oh man, I want to name names. Is that?
Go ahead. I mean, I can't.
So let's say Kaiser.
Okay.
Kaiser's the insurance company, and they are completely vertically integrated with pharmaceuticals and with medical, right? If you have Kaiser, I have Kaiser, right? I've had a decent experience with Kaiser. It's fine.
Mm-hmm. Yeah.
I get my insurance from them. I get my medications through them. I get my medical care through them. Now that is, to me, from a consumer standpoint, seems like that would be what you want. Don't they have the most control over expenses?
Well, to some degree, you're right. And so yes. And so the pitch for vertical integration is that, hey, it improves the customer, the patient experience because all of these pieces are integrated. That's the pitch. Okay. And just one other note when we're talking about healthcare in general, it's important to realize that when we talk about Medicare, which covers 40% of the population, give or take,
wow,
the incentives are completely different than when we talk about the commercial marketplace. Okay.
I see commercial being Kaiser, Medicare being more direct to the public kind of thing.
So Medicare is for people over the age of 65. Okay. So, and Kaiser probably has Medicare products that they sell. But, my work and my focus is on the employer market.
Mm-hmm.
And at the end of the day, the incentives in the employer market are that health insurers that work in the employer market, the commercial marketplace, they have no incentive to actually negotiate hard on the unit prices of the healthcare supply chain itself. They make more money when costs go up, not down. You think about it, these are publicly traded entities who have saturated the marketplace, right? They own the marketplace. There's only 4 of them, out there really. And they're subject to this cost plus price fixing scheme imposed by the Affordable Care Act. And so at the end of the day, they want their cost basis to go up. And here's the proof of this. The RAND organization had this fantastic study It came out, and I think it was 2021. And basically it proved what people that have been paying cash have known for years. And that is that anyone who pays cash for healthcare services gets a better deal on the total price of that service, the unit cost of that service, than a Fortune 50 health insurer who has millions of lives of leverage.
Yeah. But to me, that seems obvious. Like when you're in a pool with a million other people who are not wealthy enough to pay cash for their health insurance or for their medical procedures.
The care itself, yes.
The care itself, right? Because everybody would love to be able to just pay cash for that stuff because you're going to get the best deal and you're probably going to get better doctors, right? Because the Affordable Care Act kind of screwed doctors on a lot of this stuff too, which lowered the quality of services that you get and whatever.